Deep inside the human abdomen lies a 6-inch organ that quietly sustains life. The pancreas, often overlooked and rarely discussed, performs two of the body's most essential tasks. It produces the enzymes that digest every meal and the insulin that regulates blood sugar. Without it, survival becomes impossible. Yet most people remain unaware of its importance until it begins to fail. When the pancreas falters, the process is almost silent. It doesn't shout through sudden symptoms. It whispers through small, easily ignored changes. By the time the signs become undeniable, severe and often irreversible damage has already set in. Medical researchers warn that early recognition is the key to preventing life-threatening complications. But few recognize the clues in time. If you're watching this for the first time, welcome. Our goal is to bring you life-saving, evidence-based health information, the kind that empowers you to act before it's too late. Make sure to subscribe and stay connected, and let us know in the comments which part of the world you're watching from. Today we uncover 11 clinically documented warning signs that your pancreas may be in distress. Indicators that can appear months or even years before full-blown pancreatic failure develops. 1. Persistent abdominal pain. The earliest and most telling sign is deep, unrelenting pain in the upper abdomen, a pain unlike ordinary stomach discomfort. It's not sharp or burning, but a dull, constant ache that often radiates straight through to the back, forming a band-like sensation across the midsection. Studies published in leading gastroenterology journals explain that this occurs because the pancreas lies deep behind the stomach, near major nerve pathways. As inflammation sets in, these nerves transmit pain from front to back, giving the discomfort its unique depth and persistence. Unlike typical digestive pain, pancreatic pain doesn't come and go with meals. It lingers, worsening after eating, especially after consuming fatty foods. Unfortunately, many people mistake it for muscle strain or stress and delay, seeking help until serious damage has occurred. Any upper abdominal pain lasting several days, radiating to the back, and intensifying after meals demands medical evaluation. 2. Unexplained weight loss. The second warning sign is sudden, unexplained weight loss, the kind that occurs even when you're eating normally or more than usual. Medical literature defines this as losing more than 5% of body weight within 6 months without trying. When the pancreas fails to produce enough digestive enzymes, the body can no longer absorb nutrients effectively. Food passes through undigested, leading to what experts call internal starvation. Patients often lose 20 to 40 pounds despite a steady diet. As malnutrition develops, the body begins to consume its own muscle and fat for energy, leading to fatigue, immune weakness, and delayed healing. This gradual, quiet weight loss is a hallmark of pancreatic insufficiency and should never be ignored. 3. Fatty or oily stools, steatorrhea. One of the most distinctive indicators of pancreatic distress is a change in stool appearance. When the pancreas cannot release enough lipase, the enzyme responsible for breaking down fats, undigested fat passes through the intestines. The result: pale, oily, foul-smelling stools that float and are difficult to flush. They often leave a greasy film in the toilet bowl. Healthy digestion absorbs about 95% of dietary fat, but in pancreatic failure, that figure may drop below 50%. These changes, though embarrassing to discuss, are among the earliest and most visible warning signs. Any persistent alteration in stool color, texture, or smell should prompt immediate medical attention. 4. Chronic diarrhea. Chronic, persistent diarrhea that lasts for weeks or months is another major warning. This form of diarrhea differs from common stomach bugs. It's consistent, large in volume, and pale in color. Because food isn't being broken down properly, undigested particles create an osmotic effect, drawing water into the intestines. Patients experience frequent, urgent bowel movements that often worsen after meals, especially fatty ones. Left untreated, this leads to dehydration, electrolyte imbalance, and nutrient depletion, further weakening the body. 5. Persistent bloating and excessive gas. When digestive enzymes are insufficient, undigested food ferments in the intestines, producing excessive gas. The result is constant bloating, visible distension, and embarrassing flatulence. Proteins rot, producing hydrogen sulfide, the gas responsible for a particularly unpleasant odor, and while carbohydrates ferment into hydrogen and methane, the discomfort grows throughout the day, especially after meals. making even normal activities uncomfortable. This bloating is not simply a dietary issue. It's a biochemical signal that your digestive system is struggling. 6. Loss of appetite. As pancreatic damage progresses, food begins to lose its appeal. Eating, once pleasurable, becomes an ordeal. Pain after meals, bloating, and nausea all contribute to aversion. The body's hormonal feedback system, which signals hunger and satisfaction, becomes disrupted. Patients report feeling full after eating very little, or they simply forget to eat altogether. This loss of appetite worsens malnutrition, setting off a vicious cycle of weakness and decline. 7. Nausea and vomiting. Persistent nausea and occasional vomiting often accompany advanced pancreatic dysfunction. These symptoms usually arise after eating, particularly fatty meals. When fats remain undigested, the small intestine releases excessive hormones such as cholecystokinin and secretin, which can trigger nausea. Vomiting may provide temporary relief but recurs as soon as eating resumes. Unlike infections, this nausea doesn't involve fever. It's a direct consequence of a digestive system that can no longer keep up with its workload. 8. Vitamin deficiencies. As fat absorption declines, so does the body's ability to absorb fat-soluble vitamins A, D, E, and K. Each deficiency brings distinct and often confusing symptoms. Lack of vitamin A affects vision, especially in low light. Vitamin D deficiency weakens bones and muscles. Vitamin E deficiency causes muscle weakness and nerve problems. Vitamin K deficiency leads to easy bruising and prolonged bleeding. These subtle symptoms are often mistaken for aging or stress, but together they point toward pancreatic malfunction. 9. Fatigue and weakness. When your body can't absorb nutrients, energy levels plummet. Muscles waste away, blood sugar fluctuates, and even simple tasks feel exhausting. Patients describe waking up tired, struggling with routine chores, and feeling drained after meals. This fatigue results from widespread nutrient deficiency, a systemic energy crisis rooted in pancreatic failure. It's not laziness or overwork. It's biology shutting down. 10. Early diabetes symptoms. As pancreatic damage worsens, insulin-producing cells are destroyed, leading to a specific form of diabetes known as type 3C, or pancreatogenic diabetes. Early signs include frequent urination, excessive thirst, and constant hunger despite weight loss. Blood sugar levels rise because insulin production drops, leaving the body unable to use glucose effectively. In many cases, this form of diabetes develops quietly alongside digestive issues, making diagnosis easy to miss. 11. Jaundice. The most alarming sign of all is jaundice, the yellowing of skin and eyes, caused by a buildup of bilirubin. In pancreatic conditions, this occurs when inflammation or scarring compresses the bile duct. Patients may first notice dark urine and pale stools before the yellowing becomes visible. Intense itching often follows as bile salts accumulate beneath the skin. Jaundice signals a serious obstruction, one that may indicate chronic inflammation or, in some cases, pancreatic cancer. Immediate medical attention is essential. Final message. These 11 warning signs are your body's way of pleading for attention. Each one tells a story of an organ under siege, an organ vital to life itself. The tragedy is that most people dismiss them until it's too late. But knowledge changes everything. When detected early, pancreatic issues can often be managed through enzyme replacement therapy, dietary changes, and medical monitoring. If you recognize several of these signs in yourself or someone you know, don't wait. Speak to your healthcare provider and specifically mention concerns about pancreatic function. Early testing and imaging can save lives. If this documentary helped you understand these critical signals, type "helpful" in the comments. It keeps us motivated to continue creating life-saving, evidence-based content. Remember, your health is your greatest wealth, and awareness is the first step toward protection.